This video is part of a collection of testimonials and stories about the personal and professional impacts of public health emergencies. This project aims to uplift authentic experience and impactful efforts to enhance the capabilities of agencies who serve maternal and child health populations and help guide their use of existing resources and implementation of best practices in their communities.
My name is Barbara Jeffers. I work for Brazos County Health District in Bryan, Texas. I have been an RN for 30 years. I have a master's degree in nursing education, and that's why I really wanted to do this program, was to do education.
What prompted you to focus on the needs of women, children, and families? What opportunities did you see to make an impact?
I thought about, or we thought about, the fact that, this population, young pregnant women, and young women with small children, while they do go to a doctor's office and they do get information about pregnancy and they get information about their children and all of that good stuff, they don't necessarily get information about emergency situations. So I had our emergency preparedness person reach out to the county to find out what would happen for let's say a pregnant woman and a tornado touched down in our county or in our city or whatever. What provisions would be made for that particular population? And they wouldn't treat them any different than a 46-year-old. And I'm like, so if the woman goes into labor while she's at the shelter, what are y'all going to do? The fire department and the ambulance services are probably going to be tied up a whole lot with a lot of other things going on. So what are you going to do for this, And I think that's still a question that hasn't been answered yet. And my thought process is, okay, well, let's see what we can do about, getting ride shares or Ubers or something to take these women to the hospital, because they can't stay in a shelter and give birth, you know. So there's still so much more that needs to be done. We need to address this and we need to educate the community because they're not being educated on this stuff and we need to educate them.
What did you and your team develop in response?
So in the resource guide, what I wanted to do is I wanted to uh, put things in there that they could just quickly grab and read through. It's not all inclusive of everything available in Brazos County, but there's a large part of a large amount of things in that resource guide that they can turn to in the case of an emergency. So that's where the resource guide came in. And as it grew, I was like, okay, so we're going to put the education piece in the resource guide as well. So there's a whole section that's all about flooding. And, because in the flooding part, I was thinking, do young moms, do they really know not to go into deep water? Do they really get it? Do they know how to protect themselves in a tornado? I mean, really know. Are they just getting the usual things that they hear from their families? So all of those pieces went in: the flooding, the tornadoes, and the hurricane section. And then we put in everything about the COVID and the RSV and the flu. And then we put in that resource guide a immunizations schedule for 0 to 18 months, I think, and then from 18 months to 18 years. We put those immunization schedule in there so that they would know when their children need to get a vaccine, by their age. And then we also put in there an emergency plan for them to use with their family in case of a house fire or any other thing. Where would they meet? What would they, what do they need to have um, in order to in their go bag, so to speak. Um, also put in there a list of for them to put a list of their medications um, in there so that, if the only thing that they have when they leave the house, if the only thing they grab is that resource book, they've got a good start with what they need to get done once they get wherever they're going. And then we put in there also what kind of things need to go in a go bag, like, for instance, uh, copies of insurance cards or car insurance or copies of birth certificates and passports and things like that. Copies, not the original ones, but the copies. Um, and then if they have a very small baby, do they need a baby blanket in there? Do they need a baby bottle? Do they need, um, if they have a child who's 3 or 4 or 5 years old, or they need a toothbrush? They need toothpaste. So all of that went into the booklet. And then we also made the actual go bags. And I was able to make 250 of them, 250 resource books and 250 go bags with all the contents in them. We put in their rain ponchos, we put in their emergency blankets, we put in a power bank in case their phone died, and spent the entire $20,000 between those two things, the go bags and the resource book. The education part of it was free because I know how to put an educational piece together. Um, so that's what we did. Our backpack, by the way, our go bags for the students.
How did you activate a diverse group of governmental health professionals and community organizations to apply their expertise in ways that benefited a population your agency didn't have specific programming or staff to address?
And I'm going to be completely honest with you. I didn't even know there was an MCH program anywhere. I'd never heard of it in my 6 years of um, public health. So what we did was I put a team together. It was our epidemiologist, our chief epidemiologist, Dr. Yao, our emergency preparedness person, Herman Isles, and our perinatal Hep B person at the time, Deb, and myself as the project manager. And I divided between all of us, all four of us, different segments to research. So one of them, like our epidemiologist, he got COVID. Um, I did RSV, Deb did flu, and emergency preparedness did tornadoes, hurricanes, and floods because those are the most prevalent um, local emergencies, physical emergencies here in Texas. So I divided, like I said, I divided those categories up amongst the epi and the perinatal Hep B person and the emergency preparedness person and myself, and said, okay, you need to research this stuff and you need to write this out like you're teaching a class. And they had no idea what I was talking about. So I gave them a template and said, okay, so what you need to do is you need to write down what it is that you're teaching, why you're teaching it, and what is the outcome. What do you expect these people to know when they leave, at the end of their lesson? And so we did that, we put it together, and that's how we came up with the educational piece.
What realities and considerations influenced your approach?
It wasn't a very big grant. I'll tell you, it was only $20,000. And I was like, how can we use this money to the best of our ability to make the most impact on the most of the particular population that we're trying to reach, the MCH population. So I just wanted to give them something to be prepared with in case of an emergency, no matter what it was, whether it was a pandemic, if it was their child had the flu, if a tornado touched down, what could they do? And where could they go? So that's what prompted getting the education piece underway. And with $20,000, you can't do a whole lot. So I divided the project into three things. The first one was the education piece. The second one was the resource guide. And the third one was the go bags, the emergency preparedness go bags for this population.
How did the pursuit of equitable outcomes across variables such as race, primary language spoken, and citizenship influence your processes?
To consideration that not everybody speaks English. So the first part of this book is in Spanish or is in English, but if you flip it over, it's in Spanish. So it just meets halfway. So one half of the book is Spanish, the other half is in English. So we did that. We went to neighborhoods that were vulnerable, put flyers out to let them know that the classes were here and that they could also get them at WIC and Catholic Charities. And the population of Brazos County, 26.8% of them are Spanish. That doesn't seem like a lot, but it is. And they're Spanish speakers. We are lucky that on our staff right here, we have a lot of Spanish speakers. So like when I teach a class here at the health district, I have somebody in the classroom with me that can translate if they need to. Our TV clients, some of them are, people who crossed over the border, and they're afraid to, they have this distrust, obviously, with anything that's government. But we get that with our clients, that they're afraid to come in and get the immunizations, let's say, for their child. But we try to assure them that we are not going to turn them in to anybody for any reason. Our only purpose here is to help them and is to take care of them and to teach them. And that's it. We don't ask for, let me see your green card or your passport or anything like that. We don't ask for any of that. We just ask that you give us the opportunity to help you.
What would you consider your greatest successes thus far?
Creating the partnerships that we have with WIC, which you would think would be a normal partnership for a health department or health district, but we are not a part of WIC. They are not a part of us. And that's really weird to me, but creating those partnerships with Early Head Start and Catholic Charities and WIC and daycare centers, the more we can get the word out, the better off the community is going to be.
Since the initial grant funds have been spent, how are you ensuring that the focus of these efforts can be sustained?
Well, first of all, I want to say that I think by bringing in like the manager of the Head Start program here and the manager of Catholic Charities and the assistant manager of WIC into the program and teaching them the program as well and giving them also go bags and books and everything to give out, that we created this partnership. The good thing about the resource book is it can be reproduced. So all they have to do is use their own paper and printer to reproduce the book. They got an electronic copy just like you did. And that's probably one of the biggest things. As far as the go bags are concerned, well, you only have so much money to do with what you can do with, whether it's WIC or us or Catholic Charities, but they got the idea. And that's the important part, is they got the idea. So they can take this and make it their own. As long, they can make it their own, whatever they want to put in their go bags, if they do decide to do that, and I did give them some each. I gave them I gave Catholic Charities and WIC 50 go bags each and the program to teach it. And then the idea is right now we're in the process of teaching one of our staff members the program so that she can go out to the daycare centers. We can set up times for like the parents to come in and go through the class and get a go bag when they complete the class. And we can spread it around that way. And we also have classes here at the health district the third Saturday of every month. um, and uh, it's been received pretty well.
What advice would you give to public health and other leaders aiming to have a similar impact, especially if their agency doesn't have a dedicated maternal and child health program?
My advice would be to ask questions, ask a lot of questions, delve deeper into what your practice is, what you're doing. If you have an educational part of your health district, and we have an educational team actually here, um, and a health equity team, and they're very good. We do a lot of education here at the health district. Um, to ask questions, I mean, ask your emergency preparedness person the same question that I asked to the county. Do we have anything specifically for pregnant women or women with small children? And build from there. Think about what you can do to make it better because I wanted to go. I think I said this before. I wanted to get outside of the doctor's office walls because they go to the clinic, they get their prenatal vitamins, and they get all of this other stuff. And I wanted to reach beyond that because they don't get anything about emergency preparedness. They don't. And so that's what this all was leading to, is to get as many people as we can educated on that aspect.
Thank you, Barbara Jeffers, for sharing how you are making an impact in mitigating the vulnerability of maternal and child health populations during public health emergencies and natural disasters. Your reflections provide thoughtful considerations for the maternal and child health workforce, especially those working in systems without a robust maternal and child health infrastructure. This anthology is curated by the Association of Maternal and Child Health Programs, or AMCHIP, through a project funded by the Centers for Disease Control and Prevention, or CDC.